This is one of the most common questions that I get as a clinical psychologist. People asking me, well, I know that, I deal with certain issues and sometimes things frustrate me or bother me a little bit more than I think they should. But how do I know if it has reached that point where I actually need therapy? And so everybody knows, well, everybody can benefit from therapy, right? That is sort of understood, I believe. But when does a person actually need it? This is what I can speak to today in this video. And I think that the most clear answer is when you feel like there is a pattern of suffering. When you feel like there is a pattern of symptoms, it's not just a one time thing. It's not just some isolated incident. You feel down or bad or angrier than usual, for example, for just a couple of days. A lot of people have little short term slumps. But, when you have a lot of mental health symptoms, maybe feel depressed or any number of things, and you find that it's lasting, a couple of weeks, for example, well, that is definitely a pattern. And a lot of times, another sign that a person really needs therapy is when they feel like whatever symptom that they're dealing with, they can't escape it. They can't get out from under it. Imagine like you feel like you're trapped under something heavy and you can't wiggle out of it. It's like this cloud that sort of hangs over your head. Well, when people go into therapy and they actually do have a mental health diagnosis, usually they feel like it has impaired parts of their life where it is preventing them from doing things that they want to do or preventing them from doing things as naturally and easily as they feel they should. So, usually, there is some sort of impairment in school functioning, in work functioning, in social functioning. Somehow, any of these relationships or activities just become more difficult than people really feel they should.